Hey everybody, what's going on? My name is Francisco. 31 days ago I had surgery. It was ACDR, which is an anterior cervical disc replacement at C6, C7. Due to the fact that I was having incredible back pain, shoulder pain, and ultimately I started to lose a lot of strength on my right arm, which is my dominant arm. Initial symptoms happened about 2 years ago. I was on vacation and all of a sudden I just felt excruciating pain on my right shoulder, between the shoulder blade and the spine. I sought chiropractic help, massage therapy, all sorts of different type of specialists to look at it, and all of them were kind of perplexed at what was going on, but I never went to an orthopedist or a neurologist. Eventually I was recommended to go get an MRI done, and that revealed several herniations between C4, C5, C5, C6, and C6, C7. The one being the worst was the C6, C7. At the time, it was causing a lot of muscle spasms on the between my spine and the shoulder blade on the right-hand side, but it was limited to pain at the neck and pain in that general area. About 6 months later, I got another MRI done, and the other two herniations between C4, C5 and C5, C6 kind of rectified themselves, and C6, C7 were kind of better as well. It was January 15th of 2024. For some reason, well, I was actually carrying a small backpack, my son's backpack, which was nothing more than 15 pounds at most, and I started feeling excruciating pain again between the spine and the shoulder blade. That led to more pain, significant electric shocks going up and down, traveling up and down from the back to the shoulder, shoulder to the elbow, and the elbow to my fingers. Ultimately, the whole hand started to get numb, and after a couple of weeks, the whole arm just lost a lot of power to it. So there was considerable weakness and a lot of pain, especially in my forearm and right between my shoulder, right between my elbow to the armpit. Same with muscle spasms in the back and a couple of muscle spasms up top at the neck. But it seemed like the disc was pressing on the nerve that was coming out through the foramen. Due to this, I was starting to lose sensitivity in the arm, weakness, and they instantly said what you need to do is get it treated, be it a fusion, or they eventually said that they could do some sort of endoscopy, but they would have to review the procedure, which didn't give me a warm and fuzzy. So we opted to leave and go to Singapore. So in Singapore, they looked at it and they said, well, there's two options. One is going to be ACDF, which is the cervical fusion, or ACDR, which is the disc replacement. After a couple of extra tests, the doctor said, I recommend an ACDR. So I asked them what type of disc was going to be used, and they said they're going to use the ProDisc C, which has been around for ages, for decades. And it's considerably trustworthy, and from the doctor's opinion, he's an orthopedic neurologist, and he's done around 1,000 surgeries mixed between ACDF and ACDR. So I felt a little bit better of what that meant. He said in his experience, he's never had a patient of his come back and have a complaint or that they would need to move from an ACDR to an ACDF. However, what patients tend to do is give him the authority to make that decision once he's actually looking at the spine. And I said, what do you mean? He's like, well, the exams and the tests can say one thing, but until you actually see what's going on, you can't make that decision. From all the tests and the screens and everything, it's 90% chance that I can get an ACDR or I can get an ACDF at that 10%. So I said, okay, let's do it. Mind you, there was a lot of worrying, a lot of research done at the time. I probably have never been as scared as I was at that point. So I think the idea that a lot of you might be having, or at least the idea that I had, is I was going to lose mobility in my neck. I wasn't going to be strong. I wouldn't be able to pick up my kid. And that for me was really worrisome. Eventually I decided for the surgery. And oh and behold, 31 days later, this is me taking this video. So what can I say? The first days after the surgery, I won't say were excruciating, but were kind of complicated. I think the main one was right after surgery. I went in at 3 o'clock and I saw my doctor around 10 o'clock or 11 o'clock at night. I broke down in tears when he actually said, yes, it was an ACDR and not an ACDF. So that amount of stress I had coming out of surgery was very significant, definitely very worrisome. The one thing that I'll applaud him for was he was consistent with what he was talking about, and he was very, very sure of himself. The one thing I didn't like about the whole experience was the waiting. Why did I have to wait until like 11 o'clock at night? And then the following day, I was supposed to be released after 24 hours, and he didn't show up until about 8 o'clock at night, and it was like, well, it's too late to release you, so you're going to stay another day. That was on the 6th, that was 7th, and on the 8th, when I was finally released, he finally came in around 4 o'clock in the afternoon, and I was discharged around 7 o'clock in the evening. The experience of waiting and not being able to finally get out or get more word from the surgeon was appalling. I was very frustrated with that, regardless of being a great operation and him being consistent. That waiting was something that I hope you don't have to go through. It's terrible because there's nothing worse than not knowing and having questions, and someone having responses for you, answers for you, and you not getting them. I have no idea why it happened. So in the time that I had at the hospital, it was okay. I mean, there was a little bit of pain around the neck, on the back, but I had enough painkillers in me that I really didn't notice it much. I was finally let go, and then I started feeling pain around 3 or 4 days afterwards around my neck, the back of my neck, the trapezius muscles. They really hurt. They weren't kidding that they actually stretch you apart to actually put that ACDR in. And by doing so, they elongate the tendons, ligaments, muscles, I don't know what, but it hurts. And so far I've had that pain for up until now. Now and then one side will flare up. Today is kind of like the right-hand side. Yesterday it was the left-hand side. And it's pretty significant. It's not something that I like. That said, about a week after, I had to stop taking the medication that they gave me because it created a terrible indigestion. I had acid reflux, and then they were saying, coupled with moving the throat to one side to perform surgery, it caused dysphagia, which is the inflammation of the throat where you can't swallow or you can't swallow properly. I'm much better now. I can actually swallow, and it doesn't hurt as bad. But it's something that you should be prepared for. It took about 3 weeks for it to finally subside, and I'm happy it did because it's absolutely terrible. So, come here, buddy. Ben, hold on. Careful. So, dysphagia. Stop. Don't touch it, please. Dysphagia. It sucked, and the best thing that I could do, and I was recommended a couple of times, is to take insoluble fiber, take Prilosec in the morning, right first thing before I wake up, 30 minutes before eating anything. And so I was taking that, and that kind of regulated my stomach a little bit more. I was taking antacids, taking Malox, anything to help the stomach out. So I would say just this week, I'd say around 25 days, my stomach is finally better. I'm not going to say back to normal. I still get really bloated now and then. I still have a little bit of acid reflux, and I'll have like a sensation in the throat. But it's subsided significantly. As I said before, some of the biggest issues that I've had now are that now and then there's a kind of a muscle spasm between my spine and my shoulder blade, and that kind of sucks. It's absolutely terrible, but it goes away. I haven't had any numbness. I've regained all my strength in my dominant hand again, and for that I'm very thankful, and I'm very hopeful that all of these other symptoms and issues will finally go away. It has been tiring more than anything, because one day you'll just wake up and you're like, did I just revert back to what it is? And then in your head you're like, how can I revert back to it if there's no disc where there's no herniated disc at that point? And so how are those nerves being irritated again? I don't know. I just know that after a couple of hours, the pain subsides and goes away, and it's better. I haven't started physical therapy yet. My surgeon said that it'll take about 6 weeks before, or he recommended 6 weeks before I start. So as you can see, I picked up my little kid. He weighs about 30 pounds right now. I try to help out around the house and try to do as much as possible. That said, I'll start with bands and some weights around week 6 and 7 and increase from there. So I have another 2 weeks until then, but for the meantime, I'm doing much better. Again, I have complete left and right movement. I can move up, I can move down all the way, I can do rotations. Even though I'm hesitant to do them, I feel like a couple of things here and there. I suppose it's because I really haven't done anything with my neck for about 5 weeks now. Besides the 4 weeks, that week prior to surgery, I was very limited in what I was doing. And then I wore the collar for close to 3 weeks, and that really hurt. Do go through conservative options and methods to getting better. Going full tilt and getting the surgery immediately shouldn't be for anyone. Take the conservative option, see if any of that can help you out, and if it doesn't, then go for it. With the ACDR, I really haven't lost mobility, and that was my biggest worry. So that's it for me right now. Thank you very much, and again, if you have any comments, questions, concerns, drop them in the comment box, and I'll be happy to help out. Talk to you later. Bye.